Welcome back, everyone, for another deep dive. This time, we're going deep into the world of posterior crossbites.
Oh yeah, posterior
We've
crossbite.
got a great expert here with us today to help us break it all down.
Happy to be here.
And I think this is going to be a really fascinating one for our listeners. Let's just get right into it. What exactly are we talking about when we say posterior crossbite?
So posterior crossbite is when the upper teeth are sitting inside of the lower teeth.
Okay, so instead of the upper teeth kind of overlapping.
Exactly.
Gotcha. So I imagine that can cause some problems.
Definitely. It can cause problems with chewing, with the way the jaws grow and develop, and it can even impact facial aesthetics.
Okay, so not just about how your teeth look,
Yeah.
but how your whole face develops.
Exactly.
Now we've got two main types of posterior crossbites to talk about, right?
Yeah, we've got unilateral and bilateral.
And those terms always throw me off a little bit. Can you remind me which is which?
Sure. So unilateral means it's happening on just one side of the mouth, and bilateral means it's happening on both sides.
Okay, so one side versus both sides.
Exactly.
So let's start with unilateral posterior crossbites. Our sources talk about something called a CRCO shift. What in the world does that mean?
So CR stands for centric relation, and that's the most stable position of the jaw joints.
Okay, so like a natural resting position for the jaw.
Right, and the CO stands for centric occlusion, and that's how the teeth fit together when you bite down.
So ideally, those two things should line up,
Exactly.
but with a unilateral posterior crossbite.
They don't.
So the jaw kind of shifts to try and make things work.
Exactly. The lower jaw shifts to compensate for those misaligned teeth, and that creates what we call a CRCO discrepancy.
And that can't be good for the jaw in the long run, I imagine.
No, it's not good. If it's left untreated, it can lead to asymmetrical jaw growth, meaning one side of the jaw develops differently than the other.
Oh, wow. So it's not just about the teeth, it's about the whole structure of the jaw.
Right. It's like building a house on a foundation that's not level.
Okay, so this is definitely something we want to catch early.
Absolutely. The
Uh-huh.
earlier, the better.
So what can we do about it? How do we treat a unilateral posterior crossbite, especially in kids with those baby teeth still hanging around?
Well, in primary dentition, we have a few options. One common approach is to use an appliance, like a quad helix or a W arch.
Okay, I've heard of those,
Mm.
but how do they actually work?
These appliances gently expand the upper jaw, also known as the maxilla, and that creates space for the teeth to align properly.
So we're basically nudging the jaw into the right position,
Exactly.
and that helps to eliminate that jaw shift we talked about.
Right.
Okay, so it's like we're guiding the growth of the jaw.
Exactly.
But what about when kids start getting their permanent teeth? Does the treatment change?
Yes, it does get a bit more complex when we're dealing with mixed dentition, because now we have to consider both the baby teeth and the permanent teeth.
And the jaw's still growing too, right?
Exactly.
Yeah.
So it's a bit more of a balancing act.
So we're not just moving teeth around anymore.
Right. We have to take a more comprehensive approach.
Now, I know there are also some unique challenges when it comes to treating unilateral posterior crossbites in kids with things like cleft lip and palate or other craniofacial anomalies. Can you talk about that a little bit?
So in these cases, the maxilla often develops asymmetrically because of the cleft. So we have to be very careful with expansion.
Okay, so it's a more delicate situation.
Exactly. And treatment often involves a special type of appliance that gradually widens the palate.
So it's a slower, more controlled approach.
Right. We have to be careful to avoid complications like an oronasal fistula.
Now that sounds serious.
Yeah.
What exactly is an oronasal fistula?
It's basically an abnormal opening between the mouth and the nose.
Oh, wow. So that's definitely something we want to avoid.
Yes, it can cause all sorts of problems with eating, speaking, and even breathing.
Okay, so it's all about a slow and steady approach in these cases.
Exactly. We want to give those tissues time to adapt and avoid putting too much stress on them.
Well, this is all really fascinating stuff. And it just goes to show how important it is to have a skilled orthodontist who understands all the complexities of these cases.
Absolutely. Not all crossbites are created equal. And it takes experience and expertise to develop the right treatment plan for each individual patient.
Well said. Now, I know we've only just scratched the surface here,
And we have a lot more to cover.
but I think this has been a great introduction to the world of unilateral posterior crossbites.
I agree.
So let's take a quick break, and when we come back, we'll dive into those bilateral posterior crossbites.
Sounds good. Okay, so we've covered those unilateral posterior crossbites, where it's just happening on one side.
Right, and now it's time to tackle those bilateral cases where both sides are involved.
Exactly. Let's talk about what happens when those back teeth on both sides decide to play hide and seek.
And I'm already sensing that things might get a little more complex here, since we're dealing with both sides of the mouth.
You're right on the money. It definitely adds another layer of consideration when it comes to treatment planning.
So let's break it down. What are some of the main culprits behind these bilateral posterior crossbites?
Well, one common cause is what we call maxillary constriction, meaning the upper jaw is simply too narrow.
Okay, so those upper teeth are basically crammed for space.
Exactly. They don't have enough room to align properly, and that forces them inward.
So it's like trying to fit a size 10 foot into a size 8 shoe.
Perfect analogy.
Ouch.
But it's not always about the upper jaw. Sometimes the lower jaw, the mandible, is the issue.
Okay, so the lower jaw could be too wide.
Exactly. It's called mandibular expansion. And in those cases, the lower teeth are pushing those upper teeth out of alignment.
So it's like a tug of war between the jaws, and the upper teeth are losing.
That's a great way to think about it.
And of course, you could have a combination of both, right?
Absolutely. You could have a narrow upper jaw and a wide lower jaw. It's all about finding the right balance.
So how do we approach treatment for bilateral posterior crossbites? Is it similar to the unilateral cases?
Well, the good news is we have a lot of the same tools in our arsenal, but the specific approach depends on the underlying cause.
Okay, so if it's just a matter of those teeth being a bit crowded.
Then we might be able to address it with some simple dental adjustments.
Okay, like what?
Things like cross-elastics or arch wires. Those can help to gently move those teeth into a better position.
So we're fine-tuning the arrangement of the teeth themselves.
Exactly.
But what if it's a skeletal issue? Meaning the jaw bones themselves are the problem.
Then we step into the realm of orthopedic maxillary expansion.
Okay, now we're talking. I remember we touched on this earlier.
Right, this is where we use appliances to actually change the shape of the jaw bones.
And the star of the show in this category is our friend the Hyrax.
Oh, yes. The Hyrax is our go-to for rapid palatal expansion.
And let's be honest, it sounds a little intimidating.
It's definitely a powerful appliance.
I mean, we're talking about thousands of grams of force being applied to the palate.
Exactly. But it's incredibly effective at widening the upper jaw, and that allows those teeth to move into their proper positions.
So it's like we're giving that constricted upper jaw a wake-up call.
Exactly. Time to grow.
But I remember you mentioned something about overexpansion.
Yes. We can't just expand the jaw and call it a day. We have to account for something called relapse.
Right. That's where those tissues try to snap back to their original position.
Exactly. They're stubborn little things. So we overexpand the palate slightly to give those tissues some wiggle room.
So we're basically outsmarting those tissues.
We're playing the long game.
Now, besides the Hyrax, what other tools might we use for bilateral crossbite correction?
Well, we have palatal flanges, which help to distribute those expansion forces more evenly. And then there's the min expander.
Okay, and what's special about the min expander?
It delivers a more consistent and forceful expansion compared to some of the older appliances.
So it's like the Hyrax's superpowered cousin.
Something like that. And of course, we can't forget about those trusty posterior bite blocks.
Oh, yeah. Those are important for making sure the bite is comfortable during treatment.
Exactly. They help to control how the teeth mesh together as the palate is expanding.
Okay, so we've got a whole team of appliances working together.
A symphony of orthodontics.
But I'm curious about something. We've talked a lot about expanding the upper jaw. What about the lower jaw? Can we expand that too?
It's tricky. The lower jaw, or mandible, is much more solid than the maxilla.
Oh, so not as easy to manipulate.
Right. But there are some cases where mandibular expansion might be necessary.
Like when?
Well, if the lower jaw is significantly underdeveloped or constricted, for example. And in those cases, we might use functional appliances in younger patients.
Okay, so appliances that guide the growth of the jaw.
Exactly. But in adults, surgery is often the only option.
Wow, so we're talking about cutting the jawbone.
It's a procedure called a mandibular osteotomy, and it's not something we take lightly.
Definitely the last resort.
But it can be life-changing for some patients.
Well, it's incredible what orthodontists can do these days to correct these complex bite issues.
It's a fascinating field.
Absolutely. Now, I know we've covered a lot of ground here.
We have, but there's still more to explore.
So let's take a quick break, and when we come back, we'll delve into some of the other factors that can influence crossbite treatment.
Sounds good.
Okay, so we've talked about unilateral crossbites, bilateral crossbites, appliances, surgery, the whole shebang.
We've covered a lot of ground.
But there's one thing that keeps coming up that I really want to emphasize.
Retention.
Exactly.
Yeah.
It seems like no matter what type of crossbite we're talking about or what treatment we're using, retention is key.
Absolutely. It's the glue that holds everything together.
So remind us one more time. Why are those retainers so important?
Well, after we've moved those teeth and jaws into their ideal positions, the surrounding tissues need time to adapt.
Right, they've been through a lot of change.
Exactly. And those retainers act like little scaffolding, holding everything in place while those tissues settle in.
So they're preventing those teeth from drifting back to their old ways.
Exactly. Think of them as the guardians of your new smile.
Okay, that's a great way to put it. But how long do people typically need to wear retainers?
It varies depending on the individual and the complexity of the case.
Okay, so there's no magic number.
Not really.
Yeah.
But generally speaking, patients will wear retainers full-time for a few months right after treatment.
Okay, so day and night.
Right. And then they'll transition to wearing them only at night,
For how long?
often for several years.
Okay.
Yeah.
So it's a commitment, but a small price to pay for a lifetime of straight teeth.
Absolutely.
Well, I think we've given our listeners a lot to chew on today.
I hope so.
This has been a fascinating deep dive into the world of posterior crossbites, and I've learned so much.
Me too.
And I think the biggest takeaway for me is that this is not just about cosmetics.
Definitely not.
It's about overall health and well-being.
Exactly.
And it's about taking a holistic approach to dental care.
Couldn't agree more.
So to all our listeners out there, if you have any concerns about your bite or the bite of your child, please don't hesitate to reach out to a qualified orthodontist.
Early intervention is key.
Absolutely. It can make all the difference. And remember, a healthy, beautiful smile is within reach.
Thanks for having me.
It's been a pleasure. Thanks for listening, everyone, and we'll see you next time on The Deep Dive.